Traffic Radio 96.1 FM, the show that educates and brings you the latest information on everything health insurance. Now, this program is brought to you by A-Star Communications Limited, and we are your hosts. My name is Timmy, and I am Chris Obodo. Demand. So on today's show, we shall be discussing, like we let the cat out of the bag already, care for the elderly. A very important discussion that focuses on the health needs of the elderly in our society. My dad is 83, or he will be 83 this year. So I would want to know the packages that are available for him when it comes to health issues, because we know a lot of our elders have issues as they grow older.
Loads of them. I didn't have that privilege that you did, but I knew that when my dad was 75 before he left, it was a little bit of that challenge.
Yes, they do have it. So that's why we're having this conversation today. So if you have an elderly, you have your mom, your dad, your aunt who is in the elderly category. Now, today's conversation is for you. You want to sit around and listen to our topic of discussion. And talking about our experts,
yes, talking about our expert. Our expert is one lady that both of us had something in common. Taya was talking about. We were expecting an elderly person.
Yes.
And here she comes. She is Dr. Abiola Adegbola, Senior Registrar, Department of Family Medicine, Lagos University Teaching Hospital, Luth, here in Lagos. Welcome.
Thank you for having me.
Yes, we're glad you are here in the studio. And, well, it is very surprising that you are here, but I'm sure you have your wealth of knowledge, and that is why you're here to talk to our listeners this evening. So let's jump right into the conversation, Regina.
Yes,
we would want you to give us, like a layman, someone who is newly listening and who doesn't understand. Okay, we all know, but still let us know, who is an elderly?
Okay, thank you very much. So an elderly person is an individual that is 60 years and above. Okay. And then we have different school of thoughts. The World Health Organization says 65 years and above. The United Nations says 60 years and above. So it's just safe to say from 60 years and above, an individual is elderly.
60 years.
Yes.
Oh, I would
so we're not talking about, we get to hear people once they're 50 years old, you hear them, welcome to the Elders Club. So that tells you that 50, no, if you're listening, you're not yet an elder.
No, I wouldn't even subscribe to that. A 50-year-old is elderly, no.
So I'm feeling young already.
No, a 50-year-old is they are still in the middle age class.
Okay.
Not in the, elderly category.
Much better. Thank you for clarifying that.
It is a relief for some of us that are really in their 50s.
No, I'm not 50, but I'm relieved for your behalf. All right, moving forward. Are there data that tells us the estimated number of elderly people in Nigeria? Do we have data backing that up? Like we have this number of people who are in the elderly category?
Yes. So in Nigeria, the last data in Nigeria was the census that was done in 2006. They found out that at that time the population of the elderly were about like 2.7% of the population, and which amounted to 4.5 million of the population as at that time. But current data that was gathered by the WHO and the United Nations, in 2023 said that we have about 3.1%. That's about 5.1 million elderly population, and this population is growing because now we have aging population. There's now there's going to be an increase in the number of the elderly. By 2050 globally, we will have about 2 billion elderly people around. So it's a good topic.
Well, that tells us that Nigeria should begin to brace up. We can't assume that we say it's just a 3% of that, talking about 280, they say, million Nigerians. But even if it looks like it's 3 million people that are elderly, that's a good number for us to begin to talk about that.
Yes.
I agree with you, absolutely. So let me ask you, would you say that the healthcare system in Nigeria supports the care of or for the elderly?
Yeah, I will say yes. And then I'll say yes because I work in Luth, and we see about 50% of our patients are the elderly ones that we see. They come in Well, probably because they have their insurance, health insurance with us, and they come in, for consultation. So we have quite a number of them coming in. Yes. However, Nigeria is not there yet because we don't have, in the developed world, there are like geriatric centers where the centers are majorly for the elderly people.
So what you mean by geriatrics, meaning maybe gerontology?
Yes, geriatric is just simply the study of the elderly ones.
Okay. I needed
There is a study for them.
Yes, we have experts. They call them geriatricians.
Okay.
They are also doctors, but they've specialized, to only, look after
elderly.
Yes, the elderly people.
Okay, well said, well said. I'm going to go further and ask, why is it important to talk about the care of the elderly?
Yes, it's important, it's at both ends, for the physician, for the caregivers, the family and the friends. It's important to talk about the elderly. Once a child is born, aging starts. The aging process starts once an individual is born. So it's important that we are aware of the problems the elderly persons have. And for us as physicians, it's not just you're seeing the patient, the history, the examinations. There ought to be comprehensive geriatric assessment, a total overhauling. When we are seeing them, we're supposed not just to focus on their medical conditions, but focus on their cognitive functions, their activities of daily living. We should focus on their support, social support, because we see some of our elderly, when they come in, we ask them, 80-year-old man is living alone. That's a deficit somewhere that needs to be addressed. Then for the caregivers too, they need to to be aware that these people, they have some health challenges. They are not the same people they've known before. There's a lot of personality changes, a lot of dependence on them. So they should be able to, accommodate them, support them, because they are the only families they have. So they need as much support as they would, want to have.
I'm going to ask you this because you just said something that pricked something within me.
Okay.
Talking about 80-year-old being alone, does that tell that there is a shift from our culture and tradition? Because it's not a common thing to find old people living alone in Africa, much more Nigeria. So from what your interactions over the years now, I can tell your experience, are we beginning to think that elderly people are being left and there is a need to be cared for?
Yes, they are being left, Well, I've seen like so many of them, they come in and you're asking them, do you stay, are you staying alone? And they tell you, doctor, I'm alone. Even though, maybe their child brought them to the hospital, perhaps he just goes to the house, bring them to the hospital, but they live alone, Yeah, there's a shift in that. And the shift, and it's just for the caregivers to be aware that I know elderly at that age, there could be some form of stubbornness. They might not want to yield to their, bringing someone. Yes, because I saw a patient and she was like, she doesn't want anyone to stay with her. They steal her money. They do this. And I was trying to convince her that everyone cannot be bad. At least there's still that one person that can stay with you and help you with the chores and all of that. You can't, be staying alone, sleeping alone. What if there's an emergency? Who would you call on to?
Come in.
Yeah.
All right. Well said. Well said. Well, you are listening to Health Insurance Today on radio, Health Insurance Today on radio, on Lagos Traffic Radio 96.1 FM. And the voice you have been listening to as our guest is Dr. Adegbola, who is an expert in the care of the elderly. My question to you is talking about the health challenges, the health issues that affect the elderly. What are those health issues that affect our elderly here in Nigeria?
Yeah, so thank you. So we have so many of them. I'm sure we are aware of hypertension, the common ones, hypertension, diabetes, osteoarthritis, even cancer. Now, there's something we call geriatric giants. Just like now you know what geriatric means. So giants are like those diverse health conditions, that affect the elderly people. And, from visual impairments, patients, they are liable to having cataract, glaucoma, refractive errors, hearing impairment. They're at risk of infections because they have low immunity. There is risk of immobility due to osteoarthritis, stiffened joints. They are not able to move well. They have pain. hygiene. They're at risk of urinary fecal incontinence.
Wow, it's a whole lot.
Yes,
it's a whole lot. If I have to keep mentioning, this program will end on that note of mentioning.
I can't imagine. When you say that, one takes my mind back to some of the complaints you hear these elderlies mention, and we have taken that for granted.
Yes.
Really, I must say I'm guilty of that. That when they talk about, I can't walk, I can't cross, you just assume that, oh, that's normal.
And you tell them it's old age.
Yes.
Yeah, well, those are the words we use.
We said it's old age, but it's a lot of things that can be taken care of. And it's so good to hear that we have a specialist, or we have a sector of the health sector that is taking care of the elderly, and their focus is majorly on their well-being and the ability for them to manage the situation as they old and they age.
We're here today. Are there barriers to access the healthcare by elderly, or is finance a part of these? You must have had some conversations with them.
Yes, there are a lot of barriers. Finance is one of them, as you've mentioned. The cost of healthcare now is on the increase. And then particularly for the elderly, because they have multi-morbidity, they have, more than one chronic conditions. So they incur a lot of, costs, for them to access good care. Then other things, that could be a barrier is even the Japa syndrome that we have now,
Oh, really?
Yes, fewer doctors on ground. The elderly, when they come, usually they are old, frail. When they come, they just want to see a doctor and then they go back home. But most times they have to wait because, yes, they have to wait. And, they might not want to come back to the hospital if they have to wait. Another thing is support, even from their family. Some family members or friends might say, okay, you don't need to go to the hospital, you are old, you just sit at home. But when they complain to you, I have pain, I have this, it's just ideal for you to, tell them you have to go to the hospital. Let's not just manage it at home. So those are some of the barriers that would have for them to be able to access good quality healthcare.
All right, so leveraging on where you stop, my question goes to you this way. Would you say the healthcare system in Nigeria supports the care of the elderly like it does to the younger ones?
Yeah, I would say to an extent. We are not there. We don't have the, ideal geriatric centers and all of that, but we are getting there. At least in Lut, like I said earlier, we see quite a number of elderly patients, both on outpatient basis and even patient on ward admissions. Quite a number of them, we provide them with quality care. So
rating Nigeria government on the support of the elderly from the scale of 1 to 10, how would you rate it?
Well, let me give an average.
Okay.
But I want you to paint a picture of what really transpires, because we know that Lagos is a model city. We can't take it away from that, because I believe other people would be watching us, streaming, even if it's not now, later on. What are the basic things you do, particularly to help, ameliorate the financial issues for the elderly when they come?
Okay. So, it's good that we are talking on health insurance. So I think let me start with that. That's one aspect.
Okay.
Health insurance would at least help them. It will really go a long way, for them to reduce the costs of their health care, because these people have to buy medications, they have to do investigations year in and out. If they're on cancer treatments, they might need to go for chemotherapy, radiotherapy, and these things, they cost even to millions sometimes. So, bringing the health insurance scheme into the care of the elderly is a very important aspect. And currently, for the health insurance, we have the National Health Insurance Authority. That is the large body that governs, health insurance. And there is a scheme, we call it Group Individuals Family Social Health Insurance Program. This scheme helps, any individual. It's even for all age groups. It might not be particularly for the elderly, but of course we know the elderly will benefit so much from it. So they can just enroll for it, for this insurance scheme, and then pay an amount every year. I think it's even less than 60,000 that they get to pay, and then choose any hospital of their choice as their primary care, facility for them to access care. So it will really help, to reduce the cost of